As we engage in a national debate about the reopening of public schools during this global pandemic, I want to speak particularly from my experience and my knowledge about reopening New York City public schools and why it's unethical, immoral, um, and antithetical to valuing Black and Brown lives to reopen underfunded, under resourced, and frankly, unsafe germ factories during this global pandemic. I'll also talk about what needs to happen to have safe reopening. I've been a public school teacher in New York City for 6 years. I teach in a low income Title I, majority brown and black school. I also contracted COVID in March in public school. Schools have suffered from decades of systematic underfunding, particularly low income brown and black schools in our city and across the country. When City Council and the mayor passed their budget for this year, when we are in the midst of a global health pandemic, they cut 3% from the overall Department of Education budget. How are we going to protect students in schools that are already underfunded by cutting even more money? This year, the Teacher's Choice Program, which provides $250 to every teacher, was eliminated. This money was not only used for supplies like paper, pencils, and books, but it is also how most teachers purchase cleaning supplies for their classroom. In March, we experienced firsthand how fast COVID can spread in schools. Even in that week, where we really knew that we were in a global pandemic and we knew that New York City was the epicenter, we didn't receive PPE. We didn't learn new protocols. In my school, and no shade to my school, they are underfunded. My school is great, they do the best they can, but there was no soap in the boys' bathroom during a global pandemic. As a result of the unsafe environment, I myself contracted COVID, as did many of my coworkers, as did many students who brought it home to their families. The city's failure to close schools in March is yet another example of how chronic inaction and indifference put the city's 1 million public school students, their families, staff, and teachers at immense risk. A recent study released showed that if schools and other institutions in New York City had closed 1 week earlier, just 1 week earlier in March, 17,000 lives could have been saved. 17,000. It's important to note here, we're specifically talking about the loss of brown and black lives. De Blasio says that Black Lives Matter. How is he showing that Black Lives Matter when he wants to create this exact same situation that caused 17,000 deaths in March? Let's talk about why schools are germ factories and why they are ripe for the spread of COVID 19, as we saw in March when COVID 19 ripped across New York City public schools. We know that ventilation is key to preventing the spread of COVID 19, right? So, schools in New York City often have HVAC systems that do not work. An HVAC system is heat, ventilation, and air conditioning. What this looks like in normal times is that schools are uncomfortable. Rooms are either way too hot or way too cold. You almost never find a public school classroom where there's a comfortable temperature. What this lack of ventilation means now is that schools are excellent sites to transmit COVID 19. If we have window AC units in our classrooms, which is a huge if, many of them are non functional or only partially functional. Windows in New York City public school are not well suited for ventilation. If they open, and that's a huge if, they only ever open about this far. Our classrooms are crowded and they're small. This means that even with reduced class sizes, in many classrooms, it will be hard or impossible to socially distance properly. School bathrooms, especially student bathrooms, chronically lack the things that make them sanitary and safe in an epidemic. Working sinks, sinks that have hot water, working paper towel dispensers, toilet paper dispensers, doors on bathroom stalls. These are things that should be fixed anyways, but are detrimental when we're in a public health crisis. This is a picture of my classroom, which I love and miss very much. I wanted to show you a couple things. This is a pretty standard New York City public school classroom. As you can see, I have tables and not desks, which makes social distancing very hard or impossible. You can see that I do have an air conditioner unit. It works about 50% of the time, and if you were to zoom in, you could see I have a lot of tape and other stuff on it, trying to fidget with it to make it work. You can also see those windows. The windows only open a couple of inches, and only a couple of the windows open at all. As far as I know, there's been no attempt by the city to address any of these issues. Again, this isn't my school. This isn't an exception. This is the rule. I want to note here that in no way is closing schools ideal. It causes a plethora of new problems. For students with disabilities, it is incredibly hard to get students services, and many did not get them in the spring. Students have been isolated, and it's hard for their social development. Teachers have really seen this firsthand as parents. There's a lack of childcare problem. This is a last resort measure. This is a last resort because we are in the middle of an out of control pandemic in this country in which the local, state, and federal government have been completely negligent in protecting human life, and there's been no movement to make the schools safe for human life. We don't want this, but it is necessary at this time. The DOE and the city have a long history of ignoring the safety needs of low-income Black and brown schools. Until 2018, not some, but most New York City public schools had some level of lead in their drinking water. Generations of children grew up drinking lead water. As you can see from this map, the highest levels of lead were found in low-income brown and Black schools. The DOE and government knew about the issue of lead in the water, but chose to save money instead of valuing the lives of Black and brown students. Today, the government and DOE knows that reopening schools will result in an onslaught of COVID-19 cases, but is once again ignoring the safety and health of low-income brown and Black students. So let's talk about what needs to happen to reopen schools, because we all want schools to reopen and we want students back in the classroom. We can't even have this conversation until the case count is down. What that means is no new cases for 14 days in New York City before we even think about reopening schools. We need parents, staff, teachers, and students involved in reopening schools. We need their opinions and thoughts genuinely heard and taken into account. We need a commitment to reopen schools through a racial justice lens. What this means is acknowledging how the city and DOE has failed Black and brown students historically, often, in terms of health and safety. It means a commitment to listening, valuing, and incorporating the voices and needs of Black and brown communities, and it needs to focus on ending racial health and safety disparities in public schools. We need to end the practice of forcing low-income brown and Black students to pass through metal detectors in order to get into school. This is a racist practice. Not only that, forcing students to be in close proximity in an unnecessary line together increases the chance of COVID transmission. We need to reverse decades of systematic underfunding of public schools. We needed to do that anyways. It is even more imperative now. We need to invest in public schools. We need to fix outdated and broken systems, HVAC systems, air conditioners, windows. We need to make schools ventilated. We need to fix the bathrooms so the sinks work and the soap dispensers work. So to de Blasio, City Council, and the Department of Education, by sending students, teachers, and staff back into unsafe, underfunded, and under-resourced school buildings, you are sentencing people to death. You are sentencing particularly poor brown and Black New Yorkers to death. To the UFT, we cannot accept the risk to our lives, our students, and their families. If reopening moves forward, we must stand with our students and families and strike until safe return is possible.